What if the real reason your blood sugar still feels unpredictable is not only the sugar on your plate, but the silent nutrient gaps building inside your body every single day? For many older adults living with diabetes, the first signs do not arrive like a medical emergency. They arrive quietly. A little more numbness in the feet, more fatigue after a full night of sleep, cuts that take longer to close, dry skin that never seems to improve, moments of blurry vision that are easy to blame on age. But sometimes, these are not random annoyances. Sometimes, they are whispers from the body saying, "I'm running low on the tools I need to protect you." Science gives us a reason to pay attention. Research published through the NIH has shown that oxidative stress plays a major role in diabetes complications, especially those affecting the blood vessels, nerves, heart, and eyes. When blood sugar stays elevated over time, the body faces more internal wear and tear, and that can increase the demand for protective nutrients. PubMed 1. Today we are talking about 3 vitamins that are often overlooked, yet deeply connected to how the body heals, protects nerves, supports circulation, and maintains resilience with age. These are not miracle cures. They are not a replacement for your doctor, your medication, or a balanced diet. But they may be part of the missing foundation many seniors never knew they needed. Stay with me, because the first vitamin on this list may explain why some older adults with diabetes feel weaker, foggier, or more uncomfortable in their hands and feet than they did just a few years ago. And before we begin, tell me your age and where you're watching from. Then like, share, and subscribe, because every week we bring you simple, science-based guidance to help you stay stronger, steadier, and more confident in your health journey. Vitamin number 1. Vitamin B6. Vitamin B6 may not get the same attention as blood sugar, cholesterol, or blood pressure, but for older adults with diabetes, it deserves far more respect. This vitamin helps the body use protein, supports the nervous system, and plays a role in making neurotransmitters and hemoglobin. In plain language, that means it matters for nerve comfort, mental clarity, energy, and healthy oxygen delivery throughout the body. The NIH Office of Dietary Supplements notes that vitamin B6 is involved in more than 100 enzyme reactions, many related to protein metabolism, and it is important for brain development, immune function, and hemoglobin formation. CUC Bo-sung Che Duan Wong. 2. Now here is why that matters so much in diabetes. When the nerves are already under pressure from years of high blood sugar, the body needs every advantage it can get. Vitamin B6 helps support normal nerve function, and when intake is too low, people may feel weakness, confusion, irritability, or discomfort that can blend into symptoms they already blame on aging. That is what makes it easy to miss. A senior may say, "I'm just getting older," when in reality the body may be asking for better nourishment. Imagine a 72-year-old man who notices his feet feel strange at night. Not severe pain, just tingling, a little burning, a little imbalance when he gets up too quickly. He assumes that is simply the price of aging with diabetes. But after improving his meals, adding more fish, potatoes, beans, and fortified foods under professional guidance, he begins to feel steadier. Not transformed overnight, just stronger in a quiet, meaningful way. That is often how nutrition works. It does not always shout. It stores. Food is the best place to start. Vitamin B6 is found in poultry, fish, potatoes, chickpeas, bananas, and fortified cereals. These are practical, familiar foods many older adults can include without turning life upside down. The goal is not perfection. The goal is consistency. A simple dinner with salmon, a baked potato, and vegetables can do more for the body than many people realize. There is also an important warning here. More is not always better. The NIH notes that high amounts of vitamin B6 from supplements, especially taken for long periods, can actually cause nerve damage. That means self-prescribing large doses is not a smart shortcut. For seniors already dealing with numbness or balance problems, that mistake can become serious. CUC Bo-sung Che Duan Wong. 3. For older adults, the special benefit of vitamin B6 is not hype. It is support. Support for steadier nerves. Support for daily energy. Support for a body that has spent years adapting, compensating, and trying its best. Sometimes, one of the kindest things you can do for your future is give your body enough of the quiet helpers it depends on every day. Vitamin number 2. Vitamin E. Vitamin E is often described as an antioxidant, but that word can sound vague until you understand what it means in the body. Think of vitamin E as part of your internal shield. It helps protect cells from damage caused by free radicals, especially damage involving fats in cell membranes. That matters because your nerves, blood vessels, and many delicate tissues rely on healthy cell membranes to function properly. According to the NIH Office of Dietary Supplements, vitamin E is a fat-soluble antioxidant that helps protect cells from oxidative damage. CUC Bo Sung, Che Duan Wang. 4. For older adults with diabetes, this becomes especially meaningful. Diabetes increases oxidative stress over time, and oxidative stress is linked to the complications many seniors fear most, including damage to the eyes, heart, kidneys, and nerves. When the body is fighting more internal stress, protective nutrients become even more valuable. Vitamin E is not a cure for diabetes, but it is part of the body's defense system, and that system matters more with every passing year. PubMed. 1. Picture an older woman in her late 60s. She manages her medications faithfully. She keeps her doctor's appointments. But she still feels that her legs tire easily, her skin seems drier than before, and healing from even a small scrape feels slower. She has done many things right, yet she never once considered whether her meals provide enough vitamin E. This is common. Many seniors think nutrition begins and ends with sugar, salt, and calories. But health protection is broader than that. It includes the micronutrients that help the body defend, repair, and recover. Vitamin E can be found in foods like sunflower seeds, almonds, hazelnuts, peanut butter, spinach, and vegetable oils. In real life, that might look like adding a handful of almonds to an afternoon routine, stirring sunflower seeds into yogurt, or pairing dinner vegetables with a healthy fat so absorption is more effective. Small changes, repeated often, can become powerful habits. But here again, caution matters. Vitamin E supplements are not harmless simply because they are sold over the counter. The NIH warns that high-dose vitamin E supplements can increase the risk of bleeding, especially in people taking anticoagulant medications or those with certain health conditions. This is why older adults should never assume that natural means risk-free. CUC Bo Sung, Che Duan Wang. 4. The deeper lesson is this. Aging bodies do not only need control. They need protection. Vitamin E speaks to that need. It helps defend the places we cannot see but rely on every moment. The blood vessels carrying nourishment, the nerves carrying signals, and the cells doing their quiet work in the background. For seniors with diabetes, that kind of protection is not a luxury. It is part of aging with dignity and strength. Vitamin number 3. Vitamin C. Most people hear vitamin C and think of oranges, immunity, or the common cold. But for older adults with diabetes, vitamin C deserves a much larger role in the conversation. This vitamin is water-soluble, acts as an antioxidant, supports immune function, and is essential for collagen synthesis. Collagen is the material that helps hold skin, blood vessels, cartilage, and connective tissues together. The NIH Office of Dietary Supplements notes that vitamin C is needed for the biosynthesis of collagen, L-carnitine, and certain neurotransmitters, and it also functions as an antioxidant. CUC Bo Sung, Che Duan Wang. 5. That is a big deal in diabetes, because many of the struggles seniors face involve healing, circulation, skin integrity, and tissue repair. If a bruise lingers, if gums bleed easily, if the skin feels fragile, if wounds seem to close slowly, the body may be under strain. Vitamin C is not the only factor, but it is an important one. It supports the structural repair work the body must do every day, especially in later life. Now think about how easy it is for this vitamin to run low. Vitamin C is not stored in large amounts like some other nutrients. It depends on regular intake. Older adults who eat very little fresh produce, rely heavily on processed meals, or have limited appetite may not realize how quickly that gap can appear. The NIH also notes that certain groups are at greater risk of inadequate vitamin C intake, including people who smoke, those with limited food variety, and some people with chronic disease. CUC Bo Sung, Che Duan Wang. 5. Imagine a 74-year-old woman living alone. She keeps simple meals because cooking feels tiring. Toast in the morning, soup from a can at lunch, something frozen at dinner. She is not careless. She is just tired. Over time, She notices more fatigue, more dryness, more slow healing. No one told her that these quiet changes might be connected to what is missing, not only what is present. When she begins adding strawberries, kiwi, bell peppers, citrus, and broccoli into her weekly meals, she is not chasing trends. She is rebuilding support. This is where vitamin C becomes deeply encouraging. It is one of the easiest nutrients to improve through food. Berries, oranges, grapefruit, kiwi, tomatoes, bell peppers, and broccoli are all strong sources. Even simple additions can help. Half a bell pepper with lunch. A bowl of berries in the afternoon. A side of steamed broccoli at dinner. These are not extreme interventions. They are gentle forms of care. Still, more is not always better. High-dose vitamin C supplements can cause stomach upset, and the NIH lists 2,000 milligrams per day as the tolerable upper intake level for adults. In some people, especially those prone to kidney stones or with certain medical issues, megadoses may not be a wise choice. C.C. Bosung, Che-Du and Wong. 5. For seniors with diabetes, the most special benefit of vitamin C may be this. It supports repair. And repair is one of the body's most precious abilities. It helps the skin recover, helps tissues maintain strength, and helps the body respond to daily wear with more resilience. In a season of life where healing can take longer, that kind of support matters more than ever. Today, we walked through 3 important vitamins in the exact order every older adult with diabetes should remember them. First was vitamin B6, the quiet supporter of nerves, brain function, and energy. Second was vitamin E, the protective shield that helps defend cells and tissues from oxidative stress. Third was vitamin C, the repair vitamin that supports collagen, immunity, and healthy recovery. And when you step back, a powerful message begins to emerge. Diabetes management is not only about what to avoid. It is also about what the body still needs. It is not only about cutting sugar, reading labels, or remembering medications. It is also about nourishing the systems that help you stay strong, heal well, think clearly, and move through life with confidence. That is the hope in today's message. Even in older age, your body still responds to support. It still notices better choices. It still benefits from small, steady acts of care. A more nourishing breakfast. A more colorful plate. A conversation with your doctor before adding supplements. A little more attention to what your body has been trying to say all along. So let me ask you, which of these 3 vitamins do you think your body may need more of right now? B6, E, or C? Share your answer in the comments below. And if this video helped you see diabetes health in a new way, please like, share, and subscribe. Your support helps us keep creating practical, encouraging videos for older adults who want to protect their energy, mobility, and independence for years to come.